COVID could also make diabetes worse itself, or make it happen when even in people who didn't have it before. We have a risk of seeing a clash of two pandemics. Given the prevalence of COVID now in a year is actually getting very prevalent, and given the prevalence of diabetes, forget about if you cause new ones, which will make it even worse.
Doctors are looking into whether COVID-19 isn't just deadlier for people with diabetes. It's also triggering the metabolic disease in many who didn't previously have it. A study from the U.S. Department of Veteran Affairs showed that COVID survivors were 39% more likely to have a new diabetes diagnosis 6 months after getting the disease.
The virus had not just one way of potentially interfering with sugar metabolism, but multiple ways of doing so. And if the virus were able to just advance that progression from prediabetes into diabetes, and if, given the prevalence of prediabetes, you can imagine how many new cases it could potentially cause. Now, we'll have to see perhaps in the next year or two how much the effect of the pandemic will result in an increase in prevalence of diabetes.
This worsening situation could carry a heavy public health toll.
Diabetes can go undetected for a long time and create and cause damage until you figure that out. So it's better to know, or the sooner the better.
Doctors suspect the SARS-CoV-2 virus may damage the pancreas, the gland that makes insulin, which is needed to convert blood sugar into energy. Dr. Rubino has set up a diabetes registry where 500 doctors around the world can share data.
We are asking colleagues to give data about the presentation of diabetes, the characteristics of diabetes, the laboratory characteristics, but clinical characteristics, so we can say it's a type 1, it's a type 2, or something else. And then we want to also know the outcomes. Did diabetes improve, or did it worsen? Did it go away? But also, what was the most common form of treatment which in clinical practice is being used, and see if there was any trend, to see this drug may be working better than others.
Doctors are also worried about children.
We're seeing in our database already a good number of cases that are in the pediatric age. I mean, people will probably understand that this is not just a flu, that you get it, you're done with it. You might not have done with it. So it's a serious thing, unfortunately.